I'm talking to voters across the country about the issues that are important to them this election. This is Scott. For him and his family, they're prioritizing a national Pharmacare program.
My name's Scott MacMillan. I live in Dumfries, New Brunswick. That's just outside Fredericton, New Brunswick. That's where I grew up. I wrote a first person for CBC on my topic for my vote this year of Pharmacare, and a lot of that comes down to my daughter Rosemary was airlifted to the IWK when she was 15 months old.
Talk to me a little bit about the situation with your daughter.
She was diagnosed with type 1 diabetes. She almost didn't make it, but she did. Medicare saved her, but Pharmacare will keep her alive. It's moments like these, until you're in it, you're ignorant to what a truly universal healthcare system actually means, where Canada is the only universal healthcare country that doesn't have universal drug coverage. So with type 1 diabetes, her medication's not optional. It's life-sustaining, and without it, she would die.
In order to get the coverage for some of her medications, what has that been like navigating those programs?
It's difficult to navigate, and we're not unique. We're one of millions of Canadians that require prescription drugs, a lot of them to survive daily. We're one of the lucky ones. I still remember the diagnosis and the punch in the gut that it was when we were asked about insurance. I was just 6 weeks into a brand new contract at work. I honestly had no idea. I was ignorant up to that point to whether or not we had coverage, or even at that point higher importance of concern when it came to my daughter's well-being and what our future looked like. Luckily, we did have insurance. Luckily, I had emergency leave that I could take off work. A lot of people have to go to work the same day as the worst day in their lives, and requiring applications and calling to keep your kid alive is a lot of work. Diabetes can cost families up to $18,000 a year out of pocket without programs or insurance.
What exactly was going through your mind when your daughter was diagnosed and you were in that moment? Like, what were you thinking of?
Um, I had no idea at that point. Sorry. Specific to that point, we didn't fully understand what was going on. Medicare covered the emergency, the airlift, all the specialists, and yeah, then we were then asked about insurance coverage, and we were ignorant to what diabetes was at the time too. It's 24/7. It's life or death every moment. It doesn't stop when you go to bed. It's life altering for the entire family. But because we live so close to the states, I think a lot of the gaps in our healthcare system kind of gets overlooked, or gets an easy pass just because of how bad their system is relative to ours.
What have you been hearing from some of the federal parties about a national pharmacare program?
Pharmacare is still fragile where it's at right now. It's being negotiated between the provinces and the federal government, and only 3 provinces have signed on so far. So we need a party that would support it to at least give hope for someday having a comprehensive single-payer universal pharmacare, which is what everyone knows what Medicare is. So NDPs and Greens have always pushed for that Medicare vision of pharmacare. The Liberals' original language when their new leader was voted in was concerning, where it said for those who needed it, which to me implied being means tested and not necessarily being universal. But since the parties have released their platforms, it is encouraging to see that universal pharmacare is actually listed in their platform, and the goal of expanding it. The Conservatives originally voted against pharmacare, but since the election's been called, they mentioned keeping benefits that have already been issued, but no benefits have been issued yet. They just released their platform as well, stating that they'll respect the agreements that have been made between the 3 provinces, but no plans of expansion. And those agreements are only for 4 years. And then the Bloc maintains Quebec's separation to continue their pharmacare uh, coverage, which their pharmacare coverage is legally requiring people to buy into the provincial program.
How consequential does this election feel?
In the sense of pharmacare, this is the first time pharmacare has really been on the table. We should be treating insulin like oxygen when it comes to people with diabetes, or so not just for my kids, but someone's grandmother that needs cancer medication. Like we have a chance to solidify Pharmacare within our Canadian culture, and hopefully be part of Medicare, and I know, and include dental and vision, would be a dream as well. I do think this election is important to continue the evolution or the momentum behind Pharmacare.